To date, nearly 1,800 individuals have participated in this program. The first 400 tested were during the pilot phase, where we examined the implementation methods, and the doctors can answer questions on that aspect. The first 2 weeks of actual random testing have included about 700 people each week. The participants voluntarily shared information about their health and gave 2 drops of blood from a finger prick to determine whether they had produced antibodies to COVID-19. Testing for antibodies helps us track the prevalence of infection within our community at a given time. While this is not a perfect measure, and all antibody tests for coronavirus have known limitations, we believe that our data sheds new light on what is happening in our community. Prior to this testing effort, our best available information has been coming from public testing sites, the daily reports from hospitals, and the medical examiner's office. Now, this new random study can expand on that data and give us a better understanding as to how many people in Miami-Dade County have the virus and don't even know it. The random study data from the past 2 weeks gives us a very similar story. In both weeks, 6% of participants tested positive for COVID-19 antibodies, which equates to an average of about 165,000 Miami-Dade County residents. Now, when we look at positive results at our county's medical test sites, that number is about 10,000 positive cases. So what we're finding out is something we've frankly known all along. There are a lot of asymptomatic cases out there where people are carrying the virus but are not experiencing any symptoms. That's why it's so important for everyone to act as if they had the virus and practice social distancing and wear face coverings when required. Based on the preliminary findings of our random study, the actual number of infections is potentially 16 and a half times the number of those captured through testing sites and local hospitals alone. Using statistical methods, we are 95% certain that the true amount of infection lies between 4.4% and 7.9% of the population. So that would be between 123,000 and as many as 221,000 residents. Those results are similar but not identical to other recent programs that have been conducted throughout the United States. Those were not random tests that follow key demographics. Our test does focus on making sure it reflects our community's diversity by age, race, sex, ethnicity, geography, and other factors. And we continue to see that the people who tested positive for the antibodies these first 2 weeks, more than half had no symptoms in the 7 to 14 days prior to screening. Again, I repeat, more than half of those people that tested positive to this antibody screening had no symptoms in the last 7 to 14 days. Quantifying the number of asymptomatic individuals with infection is critically important for public health. Because as I said before, they are the folks that can pass on the virus to those who are most vulnerable to getting severely sick and ending up in the hospital. And that's the elderly and anyone who has certain medical conditions such as lung problems, diabetes, and heart disease. It's still very preliminary data, but we are seeing a trend that is similar from national reports, and that trend is that African Americans may be twice as likely to be infected with COVID-19 than other racial groups. The doctors can speak to the potential causes of that disparity. We're working with pastors and elected leaders to make sure that we get the word out for more medical testing in those areas that may be showing up as hotspots. We're planning our first walk-up testing site to open by next week, and that will be centrally located in the North Dade area to make sure people who do not have cars can get tested. I also want to stress that anyone who is feeling symptoms can go to Jackson Memorial Hospital or any other walk-in urgent care centers throughout the county. We will also continue random community testing for the foreseeable future. And we're also reaching out to those who tested positive to the antibodies so that we can do up a follow-up test. This may give us an insight of how long antibodies persist. This would be invaluable to help us manage the curve and get our community safely back to work again. We'll be sharing the antibodies data with the Florida Department of Health and with the University of Washington. While 6% represents a substantial infection rate, the fact that this number is held steady implies that our physical distancing is working and that together we are flattening the curve. That's why any openings we're planning for parks and other places will require strict following of social distancing, and police will be out there enforcing the rules. We want to get back to a new normal, and that's what we want to do. But we can only do so if people take personal responsibility and follow the rules. Now I'll open up to questions for me and the doctors to answer in English. Then I will say a few words in Spanish and answer questions from the Spanish media. After that, we will have our Haitian Creole translator give a summary. Patty, what do you have for us today?
Okay, Mayor, our first question is from Rosa Flores with CNN. Rosa, you can go ahead and unmute and start your video if you like. Rosa, are you there? Okay, we'll go back to her. Let's go out then to CBS 4's Joan Murray.
All right, can you hear me?
Yes, we can. Go ahead, Joan.
So I just want to review. So the infection rate you're saying is 6%, and that represented how many people in Miami-Dade County?
Represents about 165,000 people. So up to 165,000 people could be infected in Miami-Dade County. And then there's a 95% confidence rate in somewhere between 4% and close to 8%. So that could, again, that range could be anywhere from about 120,000 to over 220,000 people in Miami-Dade actually are testing positive or test positive to the antibodies. And that could be the infection rate, which is significantly higher than what the official rate is, which is about 10,000.
Okay, and then you said 60%, so more than half never had any symptoms.
Correct. More than half of the people in these the first two batches did not show any symptoms within the last week to 14 days. So they're asymptomatic. They have no symptoms whatsoever, which again goes right in line with what we've been saying all along, that you have to assume that everybody is positive. That's why these social distancing measures, wearing masks, all those measures that we put in place are so important, because what we've known all along, our gut feeling has been all along that there were a heck of a lot more people positive than were showing up as the official rate. And that's why when people kept talking about, well, you know, we have so many more people that are showing up positive, I always said, look, we look at the hospitalization rate, the utilization rate, how many people are on ventilators, how many people are actually going into the hospital with COVID-19. And we've seen a steady, you know, basically a flattening of that curve and actually a little bit dip on that curve in that hospitalization, the people that are actually getting sick, going to the hospital, needing ventilators, needing ICUs. That's been holding pretty steady now for at least a couple of weeks.
So that is flattening, but give us the larger picture then, when you can say that you have all these people who are carriers and could still be infecting. Is that really flattening the curve?
Well, because we've always known that we've had a heck of a lot more, and so I was afraid that if you focused in on we have 165,000 people that are carrying the virus, that somehow that's where you focus in on. That's not what we focused in on. We focused in on hospitalizations. It's obvious that there's been a heck of a lot more people that have been carrying the virus, that have been infectious here in Miami-Dade. The real measure is, okay, now how many people are getting sick and are actually going to the hospital? That's why social distancing, that's why wearing the mask is so important. You can't, the numbers shouldn't be what really drives you. It's really what's the hospitalization rate is. We need to continue to have social distancing. We need to continue to practice, those measures, take those measures and practice those measures, keep away from each other, have wearing masks, etc. The opening up, whatever measures we're going to do to open up, especially open the outdoor spaces, is going to be done with the same measure, those measures in mind. You're not going to be able to get close. You need to keep social distancing. And those activities that we're allowing to now resume have been vetted with our doctors, and they are the likelihood of infection is very low if you do it the right way.
Right. So that's my final question. Commissioner Sally Heyman had talked about up to 95 parks and golf courses where you walk around. And so these are very open air environments, marinas. Is that kind of going to be the extent of it right now for the soft opening on Wednesday?
Well, we haven't announced that yet, but we're anticipating that we got to get, the first thing we have to do is make sure that we have the enforcement personnel in place in those spaces, so that when people start coming to those spaces, that our measures are enforced. And so before we open up any of these spaces and the waters and the golf courses, there will be enforcement personnel in place to make sure that that is in fact happening. We're hiring over 400 people people that were out of work, either because at the Hard Rock Stadium, those kind of security personnel that know how to do this. We're hiring those folks to help our parks personnel, our marinas, our golf courses, to make sure that these guidelines, these measures are followed.
Thanks, Mayor.
Thank you,
Thank you.
Mayor. Now out to Phil Prazen with NBC6. Phil?
Yeah, can you hear me okay?
Yes, we
Yes.
can.
You said there was a pilot program of this of 400 folks. Can you tell me if there were any like changes that needed to be made after those pilot programs, the 400 people, and are those included? Like, were those test results included in that 6% and those estimates, or was the pilot program just to kind of work things out, and then we're actually looking at the actual results of the 1,400 people?
I think that's a question best as answered by Dr. Kovitz. So Dr. Kovitz, take it away.
Thank you, Mayor. Phil, the first 400 were exactly as you suggested. It was a feasibility run where we tested our implementation method and got a better appreciation of the logistics of doing community surveillance. The statistics that the mayor reported with the 6% point prevalence do not include the data from that 400. It includes the data from the 1,400 that were tested over the past 2 weeks.
Okay, that's cool. Thank you.
Thanks, Phil.
Phil, I know you had another question for the mayor for one of your colleagues.
Yeah, just branching off on the park question. You know, a lot of people are out there, you know, probably pretty antsy to get out there. Is there any concern about, you know, a mad rush into the parks once you let them open a little bit? And, you know, could people expect fines or anything if they don't obey the rules?
That's exactly why we are going to have the security measures and the enforcement measures in place before we open the parks. We don't want to get to a position or the same situation that you saw in some other jurisdictions where you open something up and then you have this mad rush and then you don't have the people there. The people will be in place. We're probably going to have a dry run, a training program, so that when we do open up, it will be done in an orderly fashion. And yes, we're serious about enforcement. And so folks that do not want to follow the rules, especially in parks, will be asked to leave the parks. And the police department will also be coordinating with the parks department to make sure that the rules are followed and that everybody understands what those rules are and that we're serious about enforcing those rules. And we're not going to allow more people in the parks than the parks can actually handle safely, social distancing, wearing a mask, etc. There are some activities that will be allowed, and there are some activities that will not be allowed. And so those will be clearly outlined in the order, and then the enforcement personnel will be there prior to any opening.
Awesome, appreciate it.
All right,
Thank you, Phil. Thank you, Mayor. Out to Christina Vasquez with Local 10. Christina, go ahead and unmute.
Hi there. So 2 questions. One, if you're able to confirm whether some of the soft opening of the public open spaces will start as soon as next week with that added enforcement. And then for the researchers on the panel here, a little bit more about reasons why you think you're said 2.5.
You're breaking up a little bit, Christina. You're breaking up a little bit. I don't know if I'm the only one having an issue hearing you.
Yeah. Well, okay. So 1, confirmation of when we might see those public spaces opening up, and then 2, for the researchers on the panel, a little bit more about the 2.5 times more, I think, Americans when it comes to being positive for COVID-19. Why do you think that would be?
Okay, Christina, I'm going to have the mayor answer the first question because I think we heard that, and text me the other one so I can ask Dr. Kovitz and Dr. Caban-Martinez for you.
We want to make sure that all of the security issues and all of the enforcement issues are in place prior to opening the parks. We're diligently working to put those in place right now. And we will be opening the parks sometime during a week. It will not be during a weekend. So that our security personnel, our enforcement personnel basically don't have this mad rush. We expect something on the weekend. We will not be opening the parks this weekend, obviously. But we're working toward, opening them as soon as possible, as long as we have already everything prepared, as long as we have the personnel there, as long as they're trained, they have their uniforms, and they know exactly what it is they need to do, and that we have adequate time to, so that the people, the residents of Miami-Dade County, can look at these orders and understand them prior to then enjoying the outdoors.
Thank you.
Okay, Christina, you want to try your other question again? I haven't gotten it from you yet, so
Yeah,
we'll
I
break
can't,
it a little bit.
I can't text it to you using my phone. So the African American rate being 2 times more, a little more about that, the African American rate of infection.
So I can try to answer that. Can you hear me?
Yes.
I think I heard your question. You were asking about the observed disparities among racial ethnic minorities. What we found here isn't different than what's been reported for the rest of the country. And I think what the mayor said in his talking points is that we haven't had the opportunity to really understand why, but we plan to engage community leaders to work with them in a collaborative fashion to better understand what may be at the heart of the increased risk of exposure and transmissibility. You know, this is an issue that COVID has brought to light, I think, the issue of health disparities that are historical and persistent for many infectious and chronic conditions. And if this becomes an opportunity to advance that dialogue and to work with local stakeholders about how to meaningfully address it, then that might be a silver lining.
Thank you.
Thank you, Doctor. We have our next question from Amy Birnbaum with CBS Network News. Amy? Amy Birnbaum, CBS News? No? Okay. Andy Slater, Fox Sports Radio.
Hi, Mayor. My question first is this study about the antibody tests, did that raise your confidence level or take it down a notch when it comes to opening up the public spaces?
It doesn't raise it or lower it. It follows what I thought was happening all along. And so if you followed me through those last month and people talked to me about positive tests and all that, and I never really was that focused in on how many people were positive. I always felt that there was a lot more people positive than were being tested, and also were coming up positive because the tests were being limited to people that were symptomatic. The tests were limited to people who are 65 and over, and so there's a whole bunch of folks that weren't even being tested. And I always felt that it was much more prevalent in Miami-Dade County than what the numbers were. I always looked at the hospitalization rate. How many people are actually getting sick, really sick, to the point where they had to go to the hospital? How many people are going on ventilators? How many people are going on ICU beds? And those are the indicators that I've been focusing in on from day one. What I thought was interesting and should be tested is what is the mortality rate of this particular disease? How does it progress through a community? And that's the reason why we're taking this. And I also want to continue doing this testing so that as we start to open up the economy, we have to have this kind of testing to see what this virus is doing as we start to open up certain sectors. And are the measures that we're taking to open up those sectors, are they working, and are they safe enough to keep us all safe? If we start seeing a spike in new cases in the community, then where are the spikes and why is that happening? Is it something that we did that we should not have done and maybe take back? So even though we may be opening up the economy and all that, we need to do it in a way that's safe and keep the social distancing and those measures so that we don't see a rise in the spike. And the reason why I want to keep on testing is this is going to be the first indicator. If you wait for then the hospital data to come in, you're going to be a week or 2 weeks behind the curve. This kind of testing needs to happen not only for research purposes, which is good, but also to kind of keep an eye on what's happening in the community all the time.
Can you also be a little bit more detailed about the 400 people that you're hiring to enforce these rules? Are you talking about the event staff people that people see at stadiums? And also, what are they exactly going to be wearing? Because you mentioned they're going to be wearing something different. Thanks.
Yeah, they'll be wearing something that says they're from Miami-Dade County and that they're Miami-Dade County employees and that they're there. These event staff folks are very good in managing large events. And so we need to hire them in order to help our parks personnel, our police personnel to keep order. We expect most of the residents will do and participate in an orderly fashion, follow the rules, but there's always some that don't. And so we're hiring them to make sure that everybody understands the rules and that that everybody maintains the rules. I mean, we'll explain it to you first, and then if you don't want to follow the rules, then we're going to have to ask you to leave. And so these are the folks that are going to help our parks personnel and our police department, handle the situation.
Thank you, Mayor. And Rosa Flores from CNN is on, but for some reason she was not able to unmute herself. So she's sent her questions to me. She wants to know, what is your biggest takeaway from the study and how is it impacting your decisions moving forward?
The biggest takeaway is it verified in my mind that there were a lot of people that had been infected or are infected in Miami-Dade. And that was just verified. It doesn't really change our course at this point. It also, I was very interested in the impact of the African American community. Want to know if it's geographical or it's demographical, or is it a combination of the two? Why is it? Why is that happening? We have to take greater measures, and more educational measures into that community, and to see if we can drive the infection rate down. And so that actually concerns me. And then we need to talk to the doctor. Is it certain spots or is it African American community as a whole? And then why is that happening? And what can we do to drive that infection rate down?
Thank you, sir. Doug Hanks with the Miami Herald.
Thank you very much. Mayor, for the working group on reopening the businesses, are you looking at any medical metrics for that timeline in terms of when to open certain phases of the economy? And would
yes, I am.
Yeah, we are. That?
Yeah, we are. Again, we look at the hospitalization rate. We look at how many people are going into the hospital, how many people are actually getting, sick to the point where they have to go to the hospital. Since we know the majority of the people that actually get COVID-19 have no symptoms whatsoever, we need to know how many, as obviously if you have a higher infection rate, even though that majority still will have no infection, no symptoms, you'll have a higher number that do have symptoms. And so we'll be looking at hospitalization rate. That's what we'll be looking at. Also, the percentage of the people testing positive starting to come down. And even with this particular test, as we see people moving from one set of antibodies to another set of antibodies, it will show that it's actually the majority are at this point in the infection, or are they at the tail end of the infection? And this antibody test has, I guess, 3 different results, or that tells you kind of progresses where the disease is progressing. That is also something that we'll be looking at, but we'll also be looking at it continuing through to make sure that that it's not rising, that it's not going up. So yeah, we'll be looking at metrics to determine what we can open, how we can open it. You'll probably see a slow opening of the spigot. You won't see a floodgate coming out at any one time. I have to also wait for the results of the recommendation coming from the actual folks, the businesses themselves, and embedded in those groups are doctors that are guiding them on how you can open that business in a safe way.
Thank you, sir. We are going to try again with Amy Birnbaum from CBS News. Amy, you want to go ahead and try again? She's on a phone line and she said she had an issue unmuting. I don't know if maybe our tech team can help out with that. Okay, so she's not able to connect. So her question is about the accuracy of the test. She's asking, how specific is the accuracy? How sure are you that it's detecting the specific antibody?
Okay, so I'll let the doctors answer that one. All right, they're the scientists. So doctor, take it away.
So thank you for that question, and thank you, Mayor, for turfing the tough ones to me. I appreciate you very much. So the test that we're using was validated in the Wuhan outbreak against PCR, which we know is the gold standard for diagnosing coronavirus. We believe that the sensitivity for this test is in the 80s and that the specificity ranges between 90 to 97%. Now, that said, when we are generating our estimates, and the mayor talked about a 90 surveillance, is gathering the best insight possible to make informed decisions about the local burden of the virus and further strategies for minimizing undue exposure and transmission.
Thank you, doctor. And she has another question. Will there be follow-up testing for those who are negative to see if they are active with the virus later on?
So do you want me to take that?
Of course, it's a harder question. I'm going to give it to you. Okay.
I think we're a really good team.
Yes, we are.
So we are going to do serial testing in a random subset of individuals that we know tested positive for antibodies. And the reason that we plan to do that is that there's very limited information to inform how long it takes for people to progress from IgM, which is the antibody which occurs early after exposure, to IgG. And so we're trying to understand that. We are not testing people who are negative because we're really focused on the fact that only 3 in 10 are potentially false negatives, and that's not the intent of what we're trying to accomplish here.
Okay, our next question will be from Patty Mazzei with the New York Times. Patty?
Hi, Mayor. Thank you. Thank you, Dr. Kobitz. Mayor, I wanted to ask you more about the workers for the parks. Did you say it was 400 workers from Hard Rock Stadium? Are any coming from any other place? Did you do that directly with the stadium or with the union? I'm just curious in sort of beefing up the enforcement part of this.
No, there's a company that has these people that have been unemployed. There's about 1,000 of them. That apparently they provide these kinds of services for all different kinds of venues. It's not just a Hard Rock Stadium. And so we're dealing with that company. That company put out a call to its employees that we were hiring for this purpose, and within an hour they had 400 people already responding. So they're looking for jobs. So we're using that company and we're using it for our purpose. These aren't Hard Rock employees. They're actually employed by another company.
Do you know how many you're going to hire?
We're going to hire at least 400, and we're going to put them to work because we have 95 parks, over maybe a couple hundred parks in the system, and then also the marinas, and then also in golf courses, and so they'll be all over the place. And again, these parks are going to be open probably from sunrise to sunset, so they'll have they won't all be working. That's more than 8 hours, so you'll have folks with different time frames. So, but at least 400 are going to be hired. And then we have to look and see what's going on with the cities, and if they need help, we may be able to help the cities too. Again, enforcement's going to be the key to this. We don't want an image of a park in a city opening up and then all of a sudden being inundated. And so the cities are going to have the right, obviously, like they always do, of when to open up and under what rules that they want to open up. But I've been working with the League of Cities to come up with a uniform set of guidelines, and they've been working with us the whole time.
Thank you. And we have up next Carlos Suarez with NBC6.
Morning or good afternoon, Mayor. How are you?
Good afternoon. How are you doing?
Good. I just have a quick question on the county's positivity rate. The state's has dropped significantly during this entire thing, but the county is taking a bit of a dip. And I'm just curious if you've either asked or been briefed on just when that number might drop a little bit more. Is it because you think maybe the criteria for testing hasn't been brought in just enough, or is the infection that deep within the county that we're not seeing that much of a drop?
I don't have the answer to that. I have to talk to my medical experts on the reason. You're talking about the typical, I guess, the PCR test that we're doing throughout the county and the drop in positives. I know that the state has had a drop in the positive rate And I believe that we're also experiencing a little bit of a drop in the positive rate. And so I've got to find out why we have a difference in the state. But again, we have more infections down here than probably the rest of the state too.
Thank you.
We have next Penny Dickerson with the Miami Times. Penny. You need to unmute yourself.
Yes, you're muted. You're muted, Penny. Penny, you're okay. There you go. There you go. Okay.
She's muted again.
There you go.
There we go.
Thank you so much. Mayor, it really pleases me to know that, one of your takeaways from this study is your concern about the racial disparities in the African-American outcome. That is really just such good news. I wanted to double back to the geographic, and that I know that in the feasibility study, Miami Gardens was included for those 1,400 for the first 2 weeks. When you identify the hotspots and you work with the stakeholders and the clergy, and this is for Dr. Kobitz as well, were there any municipalities that have high populations of African Americans that show greater results of positive results? Did you find that?
That's interesting, and I guess we can tag team this one, because that's a question I asked her yesterday when we were talking about the results and how we need to start looking at it. Because when I said demographically and geographically, we know we have African Americans in the north, south, east, and west, and we have pockets, right? In the north, I mean, down south, there are pockets of African American communities. In the north, there are pockets of African American communities. So was this a subset of geography, or was it actually demographically? And so I asked her to take a look at that. I'm not sure that she has the answer to this, but I'll let her answer it.
Thank you, Mayor, and thanks, Penny. It's nice to see you. So I don't have the answer to that yet. We are continuing to do other more detailed analysis to help answer the question that you and the mayor are posing, and really begs, I think, further consideration. Every part of the county was included in all 3 weeks of the work. And so there was a region in North Dade, there was an area in the south part of the county. We had 10 testing sites that were distributed across the county and also allowed for participation among individuals who may not have access to private transportation.
Sure.
Whether or not the results we're seeing is a function of who someone is versus where they live is not something that we've yet been able to tease out, but is something that requires further consideration, and something that I and the members of the University of Miami are collectively committed to better understanding, to inform meaningful dialogue with community leaders and next steps.
Right, because you do know that there could end up being a socioeconomic component to the health disparities.
Right, and so one of the nice things about having done sampling by minor statistical areas is that we do have the benefit of census geography that allows us to have on a neighborhood level the socioeconomic status for a given region. And so we should be able to differentiate, or at least to control for the influence of socioeconomics on the outcomes that we're observing. And that's why we're collecting this data longitudinally, and that's why we sampled by census geography, because we wanted the benefit of being able to have a comprehensive picture where we don't necessarily point to race when it's really a proxy for some other social condition that may be driving observed inequities.
Wonderful. So how much longer? Are we going 2 more weeks or 4 more weeks?
So I think that's under consideration. We have already recruited everybody for this coming week. So we know for sure that we are doing another week of the serosurveillance effort, which is random in terms of selection. And then I think on a week by week basis, we have a huddle and we decide what the appropriate next step is. And it may be that there are more targeted testing opportunities available with walk-up screening for individuals in parts of the community with excess burden of infection. So I think it's yet to be determined, because we are learning as we go.
Okay, thank you, Dr. Kobitz. Thank you, Mayor.
No, one thing is, I'm determined to have this continue, and I'm determined to have it continue. I don't know if the University of Miami is going to continue. All right, I want them to, but I'm determined to have it continue, because once we start opening up the county, we need to keep an eye on what's happening. All right. And so I'm determined to continue to do that because we, as I said, if you wait for the hospital data to come in, and now you see a peak in the hospitalization, you're already 1 or 2 weeks behind. And so we need to have this data to kind of keep the track on it, keep tabs on it. Are there hotspots? Are they starting to pop up? Why? And surveillance kind of testing, which again I think has very good research implications too. So I'm committed to actually keeping this going.
I didn't want to overcommit you to a long-term engagement.
You don't have to. I'm already committing you. Okay, so I'm committed to keeping this going.
And I did want to clarify, because I think I misspoke, that when we were talking about false negatives, it's about 1 in 10. I think I might have said the wrong denominator, and so I just wanted to clarify for the earlier question that I had answered.
Yeah, but the other thing too is that folks have to understand that even though you may have false positives, false negatives, you account for that numerically, mathematically. And so that's why you can have a 95% confidence level that the range lies between this and that, because you account for that, for those false positives and negatives, right? Right, doctor?
100%. And also, this is why a random sampling approach is so unbelievably important. So when you do a voluntary convenience sample, you run the risk that individuals who think they've had COVID on the basis of certain symptoms or known exposure to somebody who is infected overwhelmingly respond to the opportunity to participate. And so when we do a random sample, we sort of take out that potential bias from our work, and it gives us a little bit more rigor and credibility in talking about our findings and the variability that we see within the county.
Thank you all for that. We have another question now from Daniel Chang with the Miami Herald. Daniel, are you there?
Yes, I'm here. Can you see me and hear me?
Yeah, we can.
Thank you. Thank you, Mayor, for taking the question and for holding this hearing today, and Dr. Kobitz and Dr. Martinez. My question is that in order to reopen businesses and allow people to return to work, you will need serologic surveillance on a scale that no city or county in the nation is really built for yet. You'll need high throughput testing and new facilities to perform this on a large scale. And you'll also need tests that can quantify the level of antibodies once we understand how much is needed to confer immunity. I'm not sure if this test does that, and maybe Dr. Kobitz can answer that question. But my question for the mayor is, what's your plan for ensuring in the long term that serological testing is at a scale we need to allow you to reduce social distancing restrictions and reopen the economy and get people back to work?
Yeah, but that's if you want to reduce social distancing and get back to the normal, right?
Yes.
Yeah, we're not there yet, and we're not going to be there for a while. That's why when we open up, it will be with social distancing. It will be, let's say, as an example, with restaurants, maybe they're going to have to do outdoors. Okay, maybe you have to do inside. You may have to reduce the number of tables and the way that the business is run. It's not going to be. It's a new normal. We won't get to the old normal until I believe either we have vast testing of a really quick, very accurate, very quick testing, and or we have a vaccine where everybody gets vaccinated, and I think that's the only way we get back to a new normal. Outside of that, I think we stay in this posture of social distancing, masks, all that for quite a while. I don't know if you agree with that, doctor. Do you agree with that?
I do.
Okay. Dr. Kobitz, does the test measure the level of antibodies?
No. So this is a qualitative test, meaning that it just tells us about the presence or absence of antibodies. It doesn't measure the level of antibodies. And the question you're asking is really smart, because when we start to think about long-term immunity, we actually need to understand titers or the amount of antibodies. And I'm not sure that we are there yet collectively in our knowledge or understanding of COVID-19.
Thank you.
And one more question in English before we move on to Spanish. Phil Prazen of NBC6 had one follow-up on the testing. Phil, you still there?
Yep. Can you hear me okay?
Yes.
Boring government question, but what's the funding breakdown like? Like, how much did this program cost, and how many people were, assigned to work on this?
The tests, I believe, were something we bought for $200,000 to $300,000, and I don't know the rest because it's something that was needed, and so I said we got to get it done, and so it's getting done, and then we'll worry about how much it costs afterwards.
Any estimate of number of people that were, using this? I mean, are we talking 10 or are we talking like 100?
No, I think we had our lifeguards from the Miami-Dade Fire Rescue. I believe, Doctor, they're the ones that were administering the test. Those folks won't cost us any more because, well, since the beaches are closed, they didn't have to be at the beaches. And so we had them doing this, so that doesn't cost us anything. Doctor, I don't know how many personnel from University of Miami you had working on it.
So the personnel from the University of Miami are doing so on a voluntary basis. Our phone bank is staffed by medical school students who otherwise would be completing like field experiences and capstones, which have mostly been canceled because it would compromise the ability to physical distance, particularly for those who wanted to travel internationally. So that's all voluntary. And then the staff that we put in the field that works with the first responders around the administration of the test, they're also volunteering, and many of them have been moved to remote work. And so this is a way for them to fill their time and share their expertise in public health for larger collective benefit.
So
I'm just trying to find, get a better idea of like, was this 5 people going around doing it or dozens or, just any, I understand you guys might not know the specific, budgetary numbers, but any idea of estimate, like we talking 20, 30?
Well, so I know that there are 150 medical school student volunteers, and they're not all working every single day. They rotate in and out based on their course time. And this is really nice for them because otherwise they would not be able to complete some of their degree requirements in a timely fashion. And so I can quantify that. And then for each of the 10 sites, we generally send between 2 and 3 volunteers from the university.
I can get you the number of how many of our lifeguards were involved, but if you wanted to know the cost of the program, there is a cost associated with it, but not additional cost. We didn't have to hire any additional folks to do this. These were folks that were being paid for by Miami-Dade County, but since there were no beaches, there was nothing for them to do. The lifeguards had nowhere to lifeguard. So we used them for another purpose. Is there a cost attached? Sure, I'm sure there is, but incrementally, probably very little cost was not a very little incremental cost above and beyond what we already would be spending anyway.
Cool. I appreciate it.
Okay.
Thank you. And Mayor, I think we're ready now for your remarks in Spanish.
Okay. Thank you very much. Buenas tardes. Junto conmigo están los doctores Aaron Kovitz y Alberto Gabán Martínez de la Universidad de Miami. Ellos van a hablar sobre el estudio de coronavirus que estamos haciendo. Esta semana la universidad terminó su segunda ronda de pruebas de anticuerpos al virus entre los residentes de Miami-Dade que fueron escogidos. Casi 1,800 personas han participado, 400 fueron parte del piloto y 700 han participado cada semana después. Estas personas donaron 2 gotas de sangre a los doctores que hacen este estudio para determinar si tienen los anticuerpos al COVID-19. Estamos 95% ciertos que entre un 4.4% y un 7.9% de la población de Miami-Dade ha sido infectada. Eso quiere decir que entre 123,000 residentes y hasta 221,000 pueden tener, hablar otra vez, hasta 221,000 pueden tener el virus y la mayoría no tiene ningún síntoma. También es interesante saber que más de la mitad de estas personas no reportaron tener síntomas. Y eso es exactamente lo que yo esperaba. Desde el principio he dicho que todo el mundo tiene que actuar como si tiene el virus. Por eso es tan importante seguir la distancia social cuando estén en público y usar máscaras. No podemos abrir los parques o negocios en un futuro si las personas no siguen estas reglas. Este estudio confirma lo importante que es seguir las reglas en todo momento. Además, deben seguir usando máscaras cuando estén haciendo compras en negocios esenciales. Esa es la única manera de prevenir una segunda ola de infecciones. Aunque este examen no es perfecto, sí es muy importante. El estudio no ha dado una mejor idea cómo el virus se mueve entre nuestra población. Los doctores seguirían con este estudio por varias semanas más y miles de personas van a recibir llamadas porque se hagan la prueba para este estudio. Así que si por favor la reciben, sean voluntarios, es muy importante. También hemos descubierto que los residentes afroamericanos tienen una tasa de infección más alta. Por eso su cooperación es muy importante si reciben la llamada para participar. Recuerden que lo más importante es practicar la distancia social y seguir todas las reglas para prevenir más contagio. Y ahora vamos a contestar sus preguntas.
Gracias, alcalde. Y para los reporteros de habla española, recuerden que tenemos al doctor Alberto Cabán Martínez de la Universidad de Miami que puede contestar las preguntas médicas que puedan tener. La primera persona es Arly Alfaro de Telemundo 51. Adelante.
Sí, buenas tardes, alcalde. Gracias por tomar nuestra pregunta. Vamos a hablar sobre los parques. ¿Cuándo será la reapertura? Hemos escuchado que puede ser tan pronto como la próxima semana, posiblemente el miércoles, si podría confirmar eso. Y también cómo piensan enforzar las medidas o nuevas normas con la reapertura.
Bueno, puede ser hasta en la próxima semana. Todavía no se ha dado la orden para abrir los parques, las marinas y también los campos de golf. La manera que se va a hacer es, estamos contratando más de 400 nuevos empleados en el condado de Miami-Dade, personas que tenían experiencia en este tipo de eventos, porque son personas que se han contratado para lo que es el estadio Hard Rock y otros lugares donde tiene eventos grandes. 400 personas vamos a contratar para que ellos puedan estar entrenados, también darles informes para que cuando se abran los parques y otros espacios abiertos afuera, que tenemos las personas que van a enforzar las medidas. Y eso es lo que es más importante. No vamos a abrir los parques antes que tenemos las personas ya en lugar para enforzar las medidas, porque estamos muy serios sobre las medidas que vamos a tomar y que se tienen que enforzar, y las personas no pueden violar esas medidas, porque eso está todo parte de la razón que lo podemos abrir y podemos mantener la infección baja y también el riesgo de infección bajo. Y así que espero que se pueda hacer la semana que viene, pero todavía no estamos listos para anunciar eso todavía.
Gracias. Ahora pasamos con María Fernanda López de Noticias 23, MAFE. Parece que no está. Dariel Fernández. EENTU.
Yeah. Hello, Mayor. Thank you so much for the opportunity. Gracias por la oportunidad, Mayor. Muchas personas, específicamente en estos tiempos y la comunidad en general, se están manejando cuántas muertes o cuántos infectados, pero nos pudieran hablar un poquito, y creo que esta pregunta es sumamente importante. ¿Cuántas personas se han curado? ¿Cuántas en estos momentos? Y usted lo decía al principio, hay muchos que tienen esta enfermedad y que realmente no tienen hasta el momento ningún síntoma.
Bueno, si nosotros pensamos que más de 165,000 personas, por lo menos, tienen la infección o han tenido la infección, hemos tenido como 250 muertos hasta ahora. Así que puedes calcular lo que es la mortalidad de este virus. Aunque esperamos más fallecidos en los próximos días, también que lo que puedo decir es que, mira, no es la misma cantidad, lo que es la fatalidad no es lo mismo que antes pensaban muchas personas, que era un 1%, 1,5%, etcétera. Nosotros no creemos que es eso, porque la cifra es mucho más alta. Las personas que están infectadas mucho más alta que de los 10,000 que se han comprobado que tienen el virus. Así que siempre para nosotros lo importante era cuántas personas se estaban enfermando, cuántas personas estaban en el hospital y cuántas personas necesitaban respiradores, ventiladores, y también los cuartos de emergencia, lo que se llama intensive care. Nunca hemos tenido un riesgo de llegar a lo que es el límite. Siempre estamos debajo de la capacidad médica aquí en el condado de Miami-Dade. Los números han bajado, hay menos y menos personas entrando en el hospital enfermos, eso es buena noticia, aunque sabemos que hay 165,000 personas afuera que han tenido el virus y muchos de ellos no han tenido ningún tipo de síntomas. El estudio ha enseñado que más de mitad de las personas que tienen el anticuerpo no han tenido ningún tipo de síntoma en los últimos 7 a 14 días. ¿Qué quiere decir? La mayoría no tiene síntomas. Y por eso es que es muy importante que tenemos que mantener nuestra distancia social y todo, porque todos tenemos que asumir que todo el mundo tiene el virus, porque esas personas que no tienen síntomas todavía pueden pasar el virus para otra persona. Por eso tenemos que tener estas medidas sociales.
¿Qué le pudiera decir a usted, y con esto termino, ¿no? A todas estas personas que han seguido todos los guidelines, o sea, que se han quedado en sus casas, que no han salido en todos estos ya casi 40 días y que tienen miedo de decir, bueno, van a haber un tipo de apertura paulatinamente, pero tienen miedo de salir y comenzar una vida normal hasta cierto punto? ¿Qué le puede decir a esas personas?
Las personas que tienen más riesgo son las personas que tienen 60 años y más. 85% de las personas que han fallecido tienen esa edad. Así que si yo tengo 66, yo me voy a cuidar cuando salgo. Yo voy a vivir una vida más normal. Yo salgo, tengo que comprar comida de vez en cuando, pero cuando lo hago, siempre lo hago con máscara, una distancia social. No me toco la cara cuando toco en una superficie. Me lavo las manos mucho más a menudo. Eso es lo que tienen que hacer para asegurar, pero no quiere decir que el riesgo es cero, pero sí te puede bajar el riesgo para contaminarte si tomas esas medidas. Por eso es que cuando abrimos el condado, no solamente los espacios afuera, pero también de adentro, todas esas medidas todavía van a seguir. Y todos nosotros tenemos que cuidarnos a nosotros también. No es solamente el trabajo del gobierno, el gobierno va a poner las condiciones, pero nosotros nos tenemos que cuidar también. Hasta con nuestras familias nos tenemos que cuidar también, porque nosotros no sabemos si la familia no vive contigo y la familia ha salido, también tienes que mantener ese tipo tienes que actuar en esa manera con tu familia, porque ellos también pueden estar contaminados si son jóvenes y no tienen ningún tipo de síntoma, y si eres una persona de tercera edad, el riesgo es mucho más alto para ti.
Muchísimas gracias.
Gracias.
Gracias, alcalde. ¿Alguna otra pregunta en español? Okay, I think we're good with English and Spanish, and that will be all. I know you have to go, Mr. Mayor. Thank you so much. Before we go on,
thank you, Doctor. Thank you, Dr. Kovitz. Thank you, Dr. Kapp Martinez. I really appreciate your
Thank you, everyone. And before we go, we have for our Haitian Creole media and our Haitian Creole residents, Lionel Larabor, that has the mayor's remarks in Creole. Lionel?
Thank you. Bonjour tout le monde. Je dis à moi avec moi Dr. Erin Colbert et puis avec Dr. Alberto Kapp Martinez qui est capable de nous une mise à jour sur ce qui a passé en termes de tests qui a fait dans la région et avec collaboration École médecine Miller dans l'Université Miami. Ça, c'est la première partie de la déclaration que M. Carlos Gimenez fait aujourd'hui dans la conférence pour la presse là. Et dans le deuxième, dans le lit avancé, il dit tout que chercheurs ils travaillent ensemble pour être capables de déterminer qui ça qui gagne comme prévalence dans ça qui a passé dans la région, qui c'est une région qui gagne 2,8 millions d'habitants là-dedans. Jusqu'à date, il y a 1800 personnes qui ont participé dans le programme là, et pendant 2 premières semaines, il y a 700 personnes qui participent chaque semaine dans le programme ça. Et ils ont déterminé tout avec les participants, ils ont partagé et informations sur santé avec 2 gouttes de sang que vous avez pour capable déterminer anticorps que vous gagnez sur COVID-19 là. Ça c'est pas une méthode qui est entièrement parfaite parce que il y a une limite pali. Cependant, il y a un peu de lumière sur ça qui a passé dans la région nord. Dans 2 premières semaines, 6% de participants étaient testés avec test positif pour anticorps et ça était un équivalent de 165 000 personnes comme résidents dans la population noire. Test positif, c'est test qui sorti sur côté médical et test ça yo bail 10 000 cas positifs. Ça veut dire Il y a plein de monde qui a participé, qui a marché dehors, qui était positif et qui a distribué le virus là. Il est important que chaque monde prend tête comme si il était considéré qu'il un virus là eux-mêmes et que vous fait tout ça que vous capable de pratiquer distance sociale, couvrir visage les sorties en public. Basé sur données que nous avons gagné sous test au hasard, infection yo, il y a un potentiel de 16,5 fois plus que ça qui montrait déjà. Chiffre ça, c'est chiffre qui passait dans citation avec l'hôpital. Nous utilisons les statistiques que nous gagnons, effectivement, ça va nous une certitude de 95% que gagne infection qui gagne à peu près entre 4,4% à 7,9% de la population. Kounya là, chiffre ça qui ça représente en termes de chiffres, il va nous 123 000 personnes dans la population avec 221 000 résidents à peu près. Ça, c'est test qui pas répondre avec test que nous avons fait au hasard. Test que nous fait au hasard, ils répondent avec diversité l'âge, race, sexe, ethnicité, géographie et d'autres facteurs. Ça veut dire que nous quantifier toute information, c'est des informations qui sont très importantes en matière de santé publique. J'en ai dit déjà, il y a pile de monde qui a marché, qui a distribué virus ça à monde qui plus vulnérable qui a pas abouti sous cabane l'hôpital. Moun ça c'est monde qui plus âgé, c'est monde qui gagne problème médical qui existait déjà, qui a problème poumon, qui a problème diabète avec qui a maladie cœur. Données préliminaires yo capable tout simplement remonter nous à données que nous t'ai senti sur le plan national. Il y a 2 fois plus noirs américains qui souffrent avec maladie. Docteur yo capable de nous plus lumière sur cause disparité ça. Nous travaillons tout avec pasteur, avec leader local pour nous capables d'ouvrir d'autres espaces pour faire test. C'est peut-être ça qu'on a planifié pour nous l'ouvrir dans la semaine qui va venir, un nouveau site test dans Miami-Dade et test ça yo va le faire pour monde qui pas de machine, yo ka tout simplement marcher entrer. Nous pral tout mettre accent sur le fait si gon monde qui a symptômes yo même, moun sa yo capable aller dans Dickson Memorial Hospital ou bien l'autre centre qui gagne que yo relé walking yo qui en bas Memorial Hospital, yo capable aller à le faire test et aller prendre soin directement. Nous voulons tout continuer avec test ça yo pendant 2 semaines qui a venir test au hasard yo pour nous tracer anticorps yo. Ça qui veut dire que nous allons rejoindre tout le monde qui te gagne un test qui fait et test ça yo qui te gagne anticorps yo qui positif, nous allons joindre yo pour nous capable faire un suivi avec eux. Pendant que nous allons partager informations sur anticorps yo avec le département de la santé et avec l'Université Washington. Pendant que 6% représentait un chiffre assez important, mais il était stable. Ça qui veut dire que données que nous avons pour distance physique, ils marchent très bien pour nous capables de baisser la propagation du virus. C'est peut-être ça. Chaque fois que nous avons l'ouvrir un côté quand on part ou bien l'autre côté, nous exigeons que la distance sociale la respecte. La police est là pour faire respecter le règlement. Nous voulons retourner dans la vie normale. Chaque monde doit prendre responsabilité et suivre. Merci un peu.
Thank you, Lionel, so much, and we'll do it. That'll do it for this afternoon. Thank you again to the mayor and to the doctors from the University of Miami Miller School of Medicine, and to you all for joining us. Everybody have a nice afternoon.